Hello, my name's Tracey Carter and I'm really proud to be the Chief Nurse here at West Herts. If I can move to the next slide, please. So we've begun a programme of collaboration and engagement with our local community so that we can more develop and evolve our services to meet patients' needs. Next slide, please. We're doing this through our co-production board. And members of that include Hertfordshire Health Watch and several other organisations from our voluntary sector. And as you can see, this really supports our overall strategy, and also collaborative learning is essential to be able to move forward so that we can plan to reciprocate these learning opportunities for our voluntary sector colleagues as well. Next slide, please. There are a number of current engagement projects, and as you can see, that ranges from therapy apps through to carers awareness and support, and improving parental attendance through our children's and neonatal services. Next slide, please. There are a number of future projects in terms of the co-production board, and we're doing a lot of scoping work around social isolation and befriending, which is something that we're really well aware of at this time. If I can go to the next slide, please. So there's quite a bit of learning that's going on across the organisation, and we've done a lot of that through infection prevention control and really building best practice around that. And obviously that's built on the work through the pandemic as well. We move to the next slide, please. Mental health. A huge part of what we do in the integration of mental health and physical health, really looking at how we support our staff, as you heard Matthew talk about that health and well-being, so making sure we're debriefing our staff and supporting them, and that collaboration with our mental health liaison team, and of course, importantly, multi-professional working to meet the complex needs of our patients and their presentations to us to ensure a really safe onward journey from hospital. Next slide, please. And bereavement care. And that's been really an important part of what we do, especially from our learning from the pandemic around our bereavement room within our delivery suite, and providing en-suite facilities for our women during this time. And we've done a lot of work along with SANS as well, who have visited our unit, and our Maternity Voices partnership, along with our local maternity and neonatal system. And this has involved a huge piece of work to listen with women, engage with them and their partners around the environment that we have, and how we can co-produce that work to improve our bereavement pathways at what is a really difficult time of our women, their partners and their wider families' lives. Thank you very much for listening to me, and I will pass on to my next executive colleague. Thank you.